Hello everyone, I'm Walker Espea and I'm going to demonstrate the bed bath.
Doing a bed bath, let's just first do the hand washing for 20 seconds.
To perform a bed bath, first assess the patient. After arranging supplies on the table, place a bath blanket over him and remove the top covers. Now, remove a patient's gown or clothes. Fill the basin with water and then let the patient test the water temperature to make sure he can tolerate it.
Before proceeding in bathing the patient, you should remember to wear gloves first for your safety.
Merge a washcloth in water, then wring it out thoroughly. Place one towel under his head and the bath blanket on his chest. If the patient is not wearing any contact lenses, wash his eyes with plain water, bathing from the inner to the outer canthus, and using the new section of the cloth for each eye. If needed, soak the eyelid crust for 2 or 3 minutes before removing them and dry around the eyes gently. Then, thoroughly wash, rinse, and dry the patient's forehead, cheeks, nose, neck, and ears without soap. Or, if you prefer, use soap to wash these areas. Now, remove the blanket from the patient's right arm and place a towel under it and the basin under his hand. While the patient's hand is soaked, wash his hands. While the patient's hand is soaked, wash and rinse his arm from the fingers to the axilla using long, firm strokes and minimal soap and water. Then, Wash and rinse his hand and dry his entire arm and dry his entire arm and put some moisturizing lotion if necessary in his elbow and hands. If you want to provide a nail care, let his hands soak for 3 to 5 minutes and clean under his fingernails as needed. While the patient's hand is soaked, wash and rinse his arm. Then at the other side of the bed, place the towel under a patient's other arm and clean that arm, hand and axilla the same way. After cleaning the both arms, cover the patient's chest with a bath towel and fold the bath blanket down to his umbilicus. Then, bath his chest under the towel using long, firm strokes. And for female patients, take special care with the skin under the breast, lifting them up with your hand. Remember to rinse and dry the area well. At this point, change the water if needed. Otherwise, continue with the bath towel to cover the patient's chest and abdomen.